Group presentation, Hector Cruz. VVRMC initiated its first cardiac invasive program to the community back in 2005. The technology acquired for this program was from the Philips Corporation, a C-arm called the FD20, the Allura FD20, and then the recording and monitoring system from the GE Corporation called the MacLab. This program provides diagnostic and interventional cardiological procedures and diagnostic and interventional radiological procedures. Prior to this program, our residents from our community would have to travel outside, usually to San Antonio, for these types of procedures. Now, during the last 15 years, our program has managed to attract residents from other counties and other communities. In 2005, we started with just 255 procedural cases, and in 2019, we are now doing over 1,300 cases. In 2005, our program introduced diagnostic cardiology to our community. In 2012, our program introduced peripheral intervention to our community. In 2013, we introduced cardiac intervention, and in 2014, we introduced interventional radiology. Probably the most important procedure, life-saving procedure that we provide for our community is the implantation of stents. The implantation of stents are used when someone is having either an elective PCI or an active heart attack. In the last 15 years, we've had our ups and downs, but in the last 3 to 4 years, our program has encountered complicated issues that have a negative impact in our workflow. Ironically, the issues are derived from positive outcomes. They are from acquisition of more physicians. We started with 2 in 2005, and we have 7 in 2019. And the other one is the significant increase in procedural volume. Now, this has resulted in an increase in productivity and an increase in revenue. Now, the issues are, we have a C-arm that is outdated and is consistently malfunctioning and breaking down. The other issue is the inability to maintain proper workflow due to a lack of resources and human capital. Now, administration was approached, and what they recommended was that we put together a task team to provide an analysis report. So a task team was put together of 5 people, 3 from our department and 2 from other prospective departments. And they were assigned to give, like I said, an analysis report, and in the end, a final report that was titled Analysis Report, Progressive Analysis for Intervention in Special Procedures. Now, the goal of this task team, is to provide enough evidence and information so that we can turn this into an operation that can be included for budget for the next fiscal year of 2020. Now, today I would like to discuss the main details of what is needed to change the current structure for a successful outcome, which are the upgrade to our current suite, the construction of a new suite, and the acquisition of human capital. Why is there a need for an upgrade in the current suite? We have the Philips Allura FD20 that was installed towards the end of 2004 that Philips engineers have informed us that has reached its end of life at the end of 2018, and that by the end of 2019 they will no longer support it. So what does that mean? We're going to be left alone. Frequently, there is a consistent breakdown and malfunctioning of this FD20. Biomedical department is aware, and they are concerned about this, and that's why they were a part of the testing. This has caused significant problems, for example, in incomplete procedures, rescheduling of patients, and this has also caused patient complaints and bad scores. Now, we have we have an upgrade proposal by the Phillips engineers that have told us that we qualify for special programs. Not only that, but that we can also use some of our old system, the railing system, that can be used for the new machine that can be upgraded, and that all this means a savings of money. Now that we have discussed the key points needed for an upgrade, let us look at the necessity for a construction of a second suite. Why is there a need or a necessity to build a second suite? Build it and they will come. In 2005, once again, we started with 2 physicians, and in 2018, we have 7 physicians. Also, we have improved workflow. The improved workflow from a second suite would mean faster transitions from case to case. And it would mean that we would have the ability to manage emergencies better, like heart attacks, and we could accommodate scheduling better. For example, add-ons, which we have a lot. And the opportunity to have a backup plan, because if something breaks down, we don't necessarily have to cancel everything. Now that we have discussed the necessity for an upgrade in the new suite, the necessity for construction of a new suite, let us see why we need more human capital. Why is there a need for more human capital? Currently, we have 3 technologists and 3 nurses in our department. What does this mean? Staffing guidelines from SICP and ACC state that we should have 3 people in the suite during operation. And hospital policy dictates that 1 nurse should be attending to 2 patients in 2 beds. So what does this mean? This means that we have a total of 6 people currently, and I would need a total of 12 more staff members. Now, what would this do for us? It would give us the opportunity to optimize our hours of operation. Currently, number 1, this is what administration does not like, is we have a lot of overtime. By building 3 teams with 12 people, we would be able to, 1, stagger shifts, extend our hours of operation, and control the overtime, and offer longer hours for services needed. 2, we could start on-call services, which is something that has been discussed. With the ability to have 3 teams, we would be able to maintain a quality of life. 3, we have the opportunity to be proactive. Currently, administration is trying to acquire another interventional cardiologist so that we can provide a 24/7 on-call service to our community. In conclusion, we've discussed in detail the need for an upgrade, the need for construction of a new suite, and the acquisition and the much needed acquisition of human capital. We are telling our community that our mission is to provide healthcare they can trust, and our vision is to provide all healthcare needs. A Valverde health assessment that was done in 2015 found that Valverde County was above average in diabetes and obesity by 11%, above the state level. It also found that the leading cause of death in Valverde County from 2008 to 2012 were diseases from the heart. And it also identified a need to increase the capacity to address health needs for a growing population of senior citizens. What does this mean? It is our duty to our community to do this. Thank you.